Hey, what's up YouTube? My name is Jimmy and welcome to my channel. We'll start off talking about the inflammatory disease state. The two main disease states in the inflammatory bowel disease consist of ulcerative colitis as well as Crohn's disease. We'll first look into the pathophysiology between the two different disease states in terms of anatomical distribution, depth, fistulas, as well as pattern. In ulcerative colitis, the anatomical distribution is limited to only the colon itself, while in Crohn's disease, it's actually incorporated into the whole entire GI. It can be the whole entire GI. The depth is superficial in the ulcerative colitis, but it is transmural, meaning that it can go all the way through in Crohn's disease. Fistulas are not as common in the ulcerative colitis, but in Crohn's disease, it's very, very common because of the fact that it goes all the way throughout the GI. The pattern in ulcerative colitis is continuous, while as in Crohn's disease, it's non-continuous. It could be chunks into different components. The main contributing factor in both Crohn's disease as well as ulcerative colitis is dysregulation of cytokine, specifically TNF-alpha. TNF-alpha is the main contributor in terms of in the cellular cascade that causes the apoptosis of these cells. And now for the acronym component. In terms of ulcerative colitis, the U can be seen as up or upregulating cytokines. The U also stands for a top-bottom approach. In order for us to memorize these specific acronyms of drugs in the pharmacotherapy in ulcerative colitis, we can think about a sumo wrestler drinking his protein shake actively while he's actively resting. The S stands for sulfasalazine, P stands for prednisone, A stands for antimetabolite, and R stands for Remicade. In Crohn's disease, the D stands for disarray, which means that there's a disarray of cytokine production, and that leads to an overexpression of TNF-alpha, which leads to the apoptosis of these cells. The D can also be looked at as going from a top-down approach. The acronym associated to memorize these specific drugs in order is that we need a CD in order to listen to RAPs. Starting from the top-down approach, the R is Remicade, which is a TNF-alpha inhibitor. As we know, because there's a disarray, this is more important. That's why it's one of the top therapies. The A stands for antimetabolite, which specifically in this case is more methotrexate. P as purine, and S as steroid. I hope these acronyms helped you, and I'll see you guys in the next one. Peace.